Many viruses have a wide array of symptoms. There's one particular virus that causes chickenpox. I mean, it's just another virus, and your child gets little dewdrops on a rose petal, little water blisters on a red base. Other viruses, like roseola, give your child a fever for a day or two or three, high fever, sometimes 104, 105. The fever breaks, and then a red lacy rash comes out. Most viral illnesses have an acute phase of 2 or 3 days. The virus lands on a membrane, the nose or the throat, and you get an outpouring of mucus, usually a thin, clear discharge. That thin, innocent-looking discharge is probably the most contagious phase of the illness. That's why viral illnesses spread so well, because children who have a thin, runny nasal discharge don't get kicked out of preschool. They're just walking through the class going and spreading a pure viral discharge. As the illness proceeds, the white blood cells and the antibodies are called in, and there's a battle between the virus and the immune system, and you get a thicker yellowish and then a greenish discharge, which looks aesthetically unpleasant, but is the least contagious phase of the illness, and those are the kids who get kicked out of preschool. All children get intestinal ailments during winter and summer seasons, all throughout the first few years of life. The virus, instead of making itself at home in the nose or the throat, ends up in the intestinal tract, the stomach, the intestines. It initially causes irritation that sort of paralyzes the intestines, so that if your child eats or drinks, the food doesn't go anywhere, it comes right back up. As the virus works its way through the system, kids get diarrhea. Along with the vomiting and diarrhea, they can get a fever. Those kids can look pretty scary. Just as I recommend not suppressing a fever unless you have to, you shouldn't suppress intestinal symptoms unless you have to. If a child is supposed to throw up, he should throw up. If he has diarrhea, he should probably have diarrhea. There's a certain point and a certain age range. Again, those young kids with vomiting and diarrhea have to be seen by a doctor. The dividing line might not be 6 or 8 weeks of age in your doctor's office. It might be 6 or 8 months of age, where they tell you every child who's throwing up or every child who has intestinal symptoms and a fever needs an appointment. If you really think your child looks sick and you can't get that fever down, or when you do get the fever down, the child still doesn't look good, get in to see your doctor.